Good morning. Before we get started, I just want to apologize if I sound sick or my voice is weird. I'm at the tail end of COVID, so it has been an interesting couple of weeks. Anyways, I am going to present the case study on hypertension. Hopefully you guys have read over it already or will after I am done. So this case study is about patient MM. He is a 46-year-old African-American male who is coming to the clinic for his annual visit and for a new prescription for his blood pressure medication. He is a known hypertensive. He was diagnosed with hypertension 11 years ago and has been on hydrochlorothiazide for those 11 years. It seems like in recent time he is having difficult controlling his hypertension. He does have a family history of hypertension. His father died at age 49 of MI and had a long history of hypertension. His mother is alive and has hypertension as well. He is currently working as an air traffic controller. He is a widow. His wife died 15 years ago from suicide. He also has a 15-year-old son who he has a strained relationship with. His son is currently living with an aunt, so he is not living in the home with MM. As stated, MM has a history of hypertension for the past 11 years and has been taking hydrochlorothiazide for those 11 years. He did assume, or I assume he did respond to the initial treatment with hydrochlorothiazide since he's been taking it so long. But it is not uncommon for individuals with hypertension to have to be on more than one medication. Typically it is started, or a patient starts with taking hydrochlorothiazide. If that works, great, they'll stay, if a patient will typically start with taking a diuretic, whether it's hydrochlorothiazide or some other diuretic, that is up to the prescriber and that person's individual health. If the diuretic works, then they will continue taking on, that's great. If it doesn't work, typically other medications are added to the diuretic. Typical medications that are added are ACE inhibitors, ARBs, and DRIs. So obviously something has changed in recent time that has caused MM's blood pressure to go up and for the hydrochlorothiazide to not be working as well as it once was. So in talking with MM and during his discussion, during his assessment, it was revealed that he is a former smoker and he did quit when he had his initial diagnosis of hypertension 11 years ago. He did smoke for 10 years before he quit. He works a high-stress job and does have personal stressors in his life with his son. He is also a heavy drinker. It talks about that he drinks several beers every evening to relax. So that, in my mind, that would be heavy drinking. He does not like to cook or know how to cook, so he eats a lot of like microwavable meals, or he eats out a lot. So he eating a lot of processed foods. He does not exercise. He is easily winded walking up 2 flights of stairs. In the last year, his weight has increased by 10 pounds. His current weight is 221 pounds and his BMI is 31. It is noted that his heart rate is slightly irregular in rate and rhythm. His echo showed that he has moderate left ventricular hypertrophy with a current ejection fraction of 46%. Labs were drawn and they show an elevated ALT, elevated GTT, total cholesterol, and triglycerides. His urine was also positive for microalbuminuria, And when they did a fundoscopy or eye exam, it was noted that he had mild arterial narrowing in his eyes. He is currently taking, as I said, hydrochlorothiazide. His dose is 50 milligrams once a day. He has very minimal side effects from this. He takes it in the morning. He's only getting up once at night to go to the bathroom. He's taking Sudafed, 60 milligrams every 6 hours as needed. He seems to have an issue with chronic sinus headaches. He's taking beclomethasone dipropionate, 1 spray in each nostril every 6 hours as needed. Again, this is for the sinus pain and pressure that he experiences. He's taking ibuprofen for 100 milligrams either 2 or 3 times daily as needed. He has pain in his right knee from a sports injury when he was in high school. He's also taking Prilosec OTC or omeprazole as needed 2 to 3 times per week for GERD. Some important factors that led to his dose or his diagnosis of hypertension is definitely his family history, especially since his dad did die from a MI at only a couple years older than he is right now. Also, his current lifestyle choices and his weight gain probably contributed to his worsening hypertension. Based on the analysis of the case and the guidelines recommended from our text, the 2 drugs that I selected are lisinopril and losartan. Lisinopril is an ACE inhibitor and losartan is an ARB. These are typically the drugs that are chosen next, along with the DRIs if the diuretic alone is not sufficient. Both of these drugs are relatively inexpensive. They are both generic, and they are typically found on the $4 or $10 generic lists at pharmacies, where it's $4 usually for a month of prescription, or a lot of times you can get 90 days of a prescription for $10, so they're relatively inexpensive. They both also have very few side effects. The side effects for both are typically transient and are often related to just signs of hypotension, like dizziness, headache, fatigue, and orthostatic hypotension. So if he were prescribed both of these, I would definitely have him take them at different times. Both of these drugs are also available as combination drugs with hydrochlorothiazide in them. So you can get a combo drug that's like lisinopril with hydrochlorothiazide, or you can get a combo drug that's losartan with hydrochlorothiazide. So that may be an option when dealing and talking about polypharmacy and just helping him be able to take his medications at the proper time. One other side effect of lisinopril that is not a side effect of losartan and oftentimes is a reason for people to stop taking it is a dry hacking cough that's just related to the medication, and it would usually appear within the first month. So I think that's all I have to discuss about the case. I will post my critical thinking questions as well. I only did 5 of them because a couple of them are multi-part questions. I'm looking forward to a good discussion this week, and feel free to email me if you have any questions or concerns. Thanks.